Hello, guys. Our group will be doing a case study on tendinitis and specifically the case of tennis elbow. My name is D.A. Ray.
My name is Kenyatta Mills.
I'm Jack Dalpoli.
I'm Solution.
We'll be breaking up this presentation into four main parts. We'll have a background, biomechanics, stress and strain diagram, and the demographics. As for the background, as we said, we'll be focusing on tendinitis, which is characterized by the inflammation of the biological tissue that joins bone to muscle due to micro tears. There are four main components of the tendon. There's water, which is necessary for lubrication, collagen, which is a substance that provides tensility to the tendon, proteoglycans, which both retain the water for the tendon and increase compressive resistance, and tenocytes, which are what produce the needed amount of collagen and proteoglycan to maintain the tendon. All these components are necessary to maintain a functional tendon.
I'm Jack, and now we're going to be moving on to the biomechanics portion of our presentation. So starting out, we're going to want to look at the humerus, which is this large bone located in the upper forearm. And you're going to see here what's called the olecranon process of the ulna, as well as what's hidden underneath the olecranon fossa of the humerus. And this basically acts as a hinge, which allows for extension and flexion of your forearm at the elbow. Now moving on, we're going to see the extensor carpi radialis longus and brevis, which are these two muscles here, and their tendons are going to attach over here onto what's called the lateral epicondyle of your humerus. Now, these are the tendons we're going to be focusing on today that are going to act as the most commonly strained tendons for lateral epicondylitis or tennis elbow. So now moving further on to the anatomy, you're going to see this bright red muscle here, which is your extensor carpi radialis longus, and the maroon one is the extensor carpi radialis brevis. The most important thing to know between these is the longus is more superficial and has a further attachment point along the elbow, while the brevis is more deep to it and doesn't attach as far. This 30 degrees here is going to be the most ideal extension angle of your arm when you're holding an object. So when you think about holding a tennis racket in your hand, you're going to want to keep your wrist at that 30 degrees extension angle. Now, what you often see in novices, if they're going to be holding it, they're either going to have less extension or they're going to start to flex their hand through the swing, which is going to lead to problems in the tendons and is going to exacerbate some of the symptoms we're going to be looking at.
Now let's move on to the bread and butter of this course, the part where we just can't mess up. The free body diagrams. Let's start off by viewing the racket as an extension of the arm, which means that the hand and the tennis racket are one unit. So that means the summation of forces must equal 0. So if this tennis ball causes a force on the tennis racket that goes into the page, the hand has to, in contrast, provide a force that comes out of the page to keep the tennis ball, tennis racket, and the hand in equilibrium. This force that comes out of the page is compensated by the force of the extensor brevis and longus that are in the x direction. Now you might be wondering how this z force is turned into an x directional force, and that's because the muscles have a pulley-like mechanism. Let's now begin to analyze the tennis and hand unit separately and as a lever. We see that the tennis racket gets struck in the middle by the tennis ball. And the tennis racket, we can assume, is held in place at the base of the hand, or the F base. And the force provided by the base is a reaction force, as written right here. We see that although there's these two forces acting on it, they're acting in the same direction, so there needs to be a countering force, which is provided by the flexors, which are located right here. After this, we can create a summation of forces in the z direction and see that the force of the ball equals to the force by the flexors plus the force of the base. Because the flexors and base because the force at the flexors and the force of the base are in opposite directions, they cancel each other out to equal the force of the ball. Then we can do a summation in the x direction, a moment summation, and see that the force of the moment of the ball is equal to the moment of the flexors. The reason the moment of the base isn't accounted for here is because the moment at the base is 0 because the moment arm is 0. We can rearrange all of these values and get a formula for the force of the flexors. Now you may be wondering why this 30-degree angle. This 30-degree angle results from the fact that flexors and all muscles provide the most force when they are lengthened to the highest degree. When we provide this 30-degree wrist extension, the flexor muscles, which are located along the base of the hand, right where my mouse is, are really long. And that allows for the maximal gripping force. And this gripping force is necessary in order to hold the racket. Because as the velocity of the incoming ball increases, the force on the hand increases. And the force in the hand is almost like the gripping force. Now let's plug everything in. One thing we didn't calculate for yet, though, is the force of the ball. The force of the ball is calculated by calculating the velocity of the ball times the redirection constant over the contact time. We found that the time that the ball makes contact with an average tennis racket is 0.005 seconds, which is 5 milliseconds. We then get that this acceleration is 340 times the velocity of the ball. Now, the force of the ball can only be determined by multiplying the acceleration times its mass. The mass of an average tennis ball is 57 grams. So we get this as the force of the ball. Now, we also need to account for the distance of the flexors and the base of the hand, and the base of the hand and the ball. And these are as listed here. The reason we need to know these is so that we can solve for the force of the flexors. After plugging these in, we get this as the force on the flexors, and this as the force of the base, because we know that the force of the flexors plus the force of the base needs to equal the force on the extensors or the force on the hands, because the force on the hands and the force on the extensors are equal. Now that we have the force on the extensors, we are able to calculate the stress on the tendon. Using a study done by Professor Aladino, we know that the cross-sectional area of tendons is approximately this quantity. After we calculate this out, we get that the stress on the tendons is approximately this many pascals in terms of the velocity of the ball. Jack will then go on to use this quantity and relate it to the strain.
So now we're going to talk about the strain versus the velocity of the ball curve. And one thing I want to mention is that based on a study by Andrew Madsen, the modulus elasticity for an average tendon is around 500 megapascals, which was used to create this graph here. Now, as we're seeing with the velocity of the ball, a novice hits around 20 to 30 meters per second, and we can see the 3 to around 5% strain, which would cause micro tears in the fibers of the tendon. Whereas a professional is more likely to hit 40 to 50 meters per second, which will result in closer macroscopic tears. Now, this isn't exactly accurate as it doesn't account for the different levels of extension and flexion in the wrist that will lead to improper form that can cause like twists in the muscle, leading to more tears and thus greater stress placed in the tendons, resulting in tendinitis.
Hi, I'm Zui Shen. I'm talking about demographics. Chronic problems caused by overuse of tendons probably accounts for 30% of all running-related injuries, and the prevalence of elbow tendinopathy in tennis players can be as high as 40%. And for risk factors, the first one is age. There's an increased risk of tendon injuries with older age, and the most commonly affected age group is from 42 to 54 years old. And for technique, the group with the highest risk for tennis elbow were beginners to the sport. Tennis players are trained to keep the extension in their wrist for a more stable backhand. And for gender, women are at greater risk of sustaining injuries during physical activities, which has been explained by the potential effect of hormones.
That's all, folks.